Yes, but
great story. I have it.
and if you have no money, that's fine. It's fine. It's not about money. Okay? Thank you. Yeah. Thank you for coming. You're on to great careers. I can feel it. Okay? You've got a good teacher.
So, Glennis,
Yes.
You just want us, if we're interested, just to volunteer in any capacity that we can?
Yes.
Because you understand, as nursing students,
You have no
we have
time.
very little
I know.
time,
I know. Even if it's only once every 6 months or when you're on vacation. Even after training everybody, and a lot of people do not have any jobs, in older people. I only ask for 4 hours a month. And some don't even give that, but maybe they'll have a day off 4 months later. And then I have another volunteer that I had a patient dying. He did 5 nights in a row for 14 hours.
Yeah.
But he doesn't have any hours to give right now. Oh, yes, he does. He gives 4 hours at the moment.
It comes and goes.
Yes.
But we don't,
And that's why it has to be.
X next year.
No,
You do
no.
not. Well, what you do, you get gold stars. I mean, we're so happy to take what you can do. And we're just starting to put this into teams.
Yes.
We're having a big meeting with Tim, and next week.
I need team leaders so that they can take some patients and maybe staff them for me because I'm getting overwhelmed.
Everybody calls Glennis, so, we need volunteers to be team leaders as well who know the team members, meet with the team members, and find out what the team members are interested in doing, when they possibly could help out if we get a patient, what hours are good for them, sorry, I only have an hour, sorry, I only have 2 hours. Great! So we're not bugging people or asking people to do something
Just call in. Call in every week or send me an email so that I'm not calling everybody.
Right.
And
anyhow, that's our, so
yes.
We're meeting next week to organize that, put everybody in, and I'm going to be a team leader.
Yes. And if you have any ideas how this should be run or what I'm missing, I'm open to ideas.
Yes,
yes.
She is.
Yeah.
So how would you describe what is the difference of your organization, let's say, to a traditional hospice or to a home health?
Okay.
Besides the funding.
Well, mine is free. Every hospice has volunteers, but the rules have changed in Medicare. So a lot of the hospice volunteers now, and it's much needed emotional care, but they're not allowed to change a diaper.
Or transfer. Nothing like the old days. If you're a hospice volunteer, you can sit by the bed.
You can cook, you can do the washing, which is important.
Give a glass of water, you can read to the patient, but you may not transfer the patient, reposition the patient, help the patient with elimination needs or anything like that. Big, huge difference. We are volunteer, we are not insurance driven, which is why it was important for me to make a statement that we are completely volunteer. We have no money. We operate off grants, so we do not have to follow Medicare, Medicaid, or JCO guidelines. Actually, I feel like our level of care is somewhat a lot more quality than what I've seen coming out of hospices, as well as in nursing homes. We're there because we want to be. The volunteers are there doing the work because they want to do the work, and they feel it's a privilege. So it's very different kind of care.
Yes.
It's the ideal care.
Yes.
So just sort of as information for the nursing students and others, service learning, those of you going into level 2 and then going on to level 3
yes.
are hours or 10 hours and 9 hours, and for full financial aid you need 12. Service learning over the summer, you can service learning for your volunteer credits.
And you can get college.
Yes.
You get
college credits.
Semester you're about to go into, so it could be something that this summer, when you have a lot of extra time.
Well, I tell
Yes.
everyone, because in my CNA classes, I get a lot of volunteers that come and do the training and then volunteer. You have some people in your class in level 1 that are actively involved in coming home. And then my medical terminology class, and they get service learning credits in half for the past year. So it's a great way if you're scholarshiped or getting some sort of financial aid. This is a wonderful way to turn it around for the
Yes.
community. And it's right up your alley, and it's a great experience.
How frequently are your trainings?
Every month. We're skipping
Yeah.
February. We're down to the financial crunch. No, we're skipping February because we've got meetings, we've got
A lot of
workshops,
meetings, trying to get everything.
I'm trying to get this team leading concept and teams.
I was just thinking for the summer opportunity, the students should take the training in
Yes.
May in order to avail themselves of
I'll be
that
there.
opportunity
Yes.
this summer.
Yeah.
Yes.
And our trainings are always done at the Cancer Treatment Center. Although, one
But
time
we get
we
the,
were at Capitol High, oh my God, I think it was last January.
it was
And the
freezing
furnace-
cold.
Furnace did not work, and you know how cold our whole building is that has not been heated. It's
And we were in a
so cold.
portico.
And they all wanted to see, how that was made, and so I got the whole group. There were about 60
Yes.
over to my house, and we did the whole training all weekend at my house.
We were frozen.
Bedrooms, the sheets were flying, baths were being given, transfers were being done, and we did it. You just do it. You do.
Yes.
So I'm counting on the Cancer Treatment Center conference room.
Yes.
But there are options.
Yes. There are many options.
Always.
And the last year of high school students get a college credit doing that. Yes.
They're incredible.
Oh.
Oh my God. They
Oh,
bring
they're
me to my
so
knees.
enthusiastic.
They're innocent, brilliantly innocent. So there's such poignant questions and such an easybility of acceptance of things that, as I get older, I have challenges accepting. What I mean by that is their prejudices are few.
Yes.
Their ability to let it all in and be open to all possibilities is huge. And that's such a huge
Yes.
motivation to some old gnarly woman like me who's like,
Whoa. I'm worse than you. And then,
yeah, sometimes I get a little
Yes.
discouraged at what's out there and what I have to undo so that they can come through and be like those children. And
Yeah.
they're not children, they're wise beings that maybe chronologically are 16, 17, 18. Precious. Precious people. And they're all safe. You don't go out as a volunteer typically by yourself the first time. You always have a very experienced volunteer with you.
yes.
You don't go to a place, or most of all, a situation that you have already expressed, and believe me, we get your preferences, discomfort with. Some people actually, and I know you guys will be forced to, face their discomforts and use that as an opportunity with someone else to take a look at why is this a challenge to me personally, and why does this